Hey there, Bruno Lorida here with Larry Bio Consulting. I had a great time interviewing the incredible Professor Yehuda Shoenfeld recently. We covered some mind-blowing topics on the latest advances in autoimmunity. It's called Everything You Wanted to Know About Autoimmunity, but Were Afraid to Ask. This is part 2, the link between autoimmune diseases, silicone implants, and COVID syndrome. I'm Bruno Lorida with Larry Bio Consulting, and today my guest is
Yehuda Shoenfeld. I'm a physician, researcher, and a teacher in the field of autoimmunity, the founder of the first Center for Autoimmune Diseases in the Sheba Medical Center in Israel. So today we understand at least one of the most important factors, infectious agents, which now the most notorious is the COVID-19, and it replaced EB virus, the virus of infectious mononucleosis, the kissing V, as a cause of autoimmune diseases. Understanding this mechanism may help us in similar conditions. So, for instance, we worked for the last 40 years on the association of silicone breast implants in young women at the childbearing ages, which were misbelieved. Maybe it was a mistake. Maybe it was deliberately believed like that the silicone is inert to the immune system. It does not react with the immune system. And it has been found the opposite. The silicone was found to be very similar, like the COVID-19, as an adjuvant, which comes from the Latin word adjuvare, to help. The silicone exists in the body of the young woman for years, actually more than is instructed. In brackets, most of the surgeons do not instruct that you have to replace it every 6 years, etc. Even when the silicone wrapping is not ruptured, the silicone bleeds, and we found the silicone at the bone marrow, at the vertebral column, and even in the inguinal lymph node. It stimulates the immune system consistently. In whom? In a young women, or those women who are or having a very aggressive immune system. And especially if those women carry also the genetic markers, they will develop these autoimmune diseases. In a large study that we carried out on 20,000 silicone implantee, compare them with 100 young women matched for age without silicone, we found all autoimmune diseases more prevalent among the women with silicone implant. Now, some of
Do we know which autoimmune disease?
from sarcoidosis to systemic lupus, from fibromyalgia to multiple sclerosis, and so forth. This was published in International Journal of Epidemiology, a very respectful journal in this field. However, with the silicone implants, many of the women develop very peculiar list of complaints, all of them subjective, from cognitive impairment, putting the keys of the car in the refrigerator, to sleeping disturbances, memory loss, as well as widespread pain, fibromyalgia, severe fatigue, but additional symptoms like dry mouth and dry eyes, sweating problems, tachycardia, rapid heart rate, etc. So physicians, whether they are GPs, even rheumatologists, and definitely not the plastic surgeon, could not make the story of all this panoply of complaints with the silicone implants. Now, I will tell you the very interesting fact that also people with the COVID syndrome, and more than that, the post-COVID syndrome, the syndrome which appears several months after you encounter the virus per se, they suffer from the same complaints, overlapping complaints between the silicone implant. These overlapping complaints can be found also in subjects with chronic fatigue syndrome, subject with fibromyalgia, subject with sick building syndrome. Once they move from the office or from the building that they are living, all the complaints disappear. This is the same with the silicone implants. 86% of those women who had the silicone implants, when the implant was explanted, they recover from the symptom. So how to explain all this story? We, as an autoimmunologist, for decades, we believed that it's autoimmune, and we were able to decipher this enigma, which may help in all the conditions, in all the syndromes that I mentioned, which all of them are of autoimmune origin. We deciphered the enigma. And now I'm going to explain it. This is the revolution that we are now preaching in many congresses, in many articles. You can just click my name, Shoenfeld, and you will find the explanation. So I would like to explain the differences between two systems in our body. The nervous system, the regular central nervous system. I take my finger and touch my nose. I wanted to touch my nose. Now I have taken off the fingers, etc. But we have another nervous system in our body called the autonomic nervous system. When we chew and eat cake or whatever, and we need the saliva to be discharged from our glands, we have no control. It's done autonomically, automatically. This is done by the autonomic nervous system. Also, when we stand from the recumbent position to an erect position, the heart, the blood pressure, adjust themselves automatically, autonomically. We don't have a care of it. This nervous system, the autonomic nervous system, consists of two arms. One is the sympathetic arm, and the other is the parasympathetic. And they are in balance. Also, when we need to secrete the saliva, one will stimulate the glands, but then the other will stop the reaction and they will come into balance. If there is imbalance and one of the arms is more activated, we call it dysautonomia. It raises many, many complaints. All of them are subjective. So following an extensive research, which took years and many collaborators in Germany, in Italy, in other countries, we were able to publish the results, the revelation. So following the COVID virus, the EB virus, the silicone implant, the sick building syndrome, which is believed that it is caused by mold which stimulate your body, following some vaccines in which there is an adjuvant containing aluminum, which stimulate the immune system. In all those conditions, we found autoantibodies, missiles which are redirected against our constituents, which are autoantibodies against the autonomic nervous system. There are 20 different autoantibodies that we were able to detect using the laboratory of Cell Trend in Berlin. And these autoantibodies, by binding to the receptors of different parts of the autonomic nervous system, cause dysautonomia. This means that you will have widespread pain because the receptors of the autonomic nervous system are distributed all over our body, especially in the small nerves. And therefore, in all these conditions, we can find small fiber neuropathy, which can be detected by a small biopsy from the skin or even by looking at the eye in the eye with a special equipment. As well, these autoantibodies can explain the rapid heart rate. It can explain the severe fatigue in which mother will not wake up in the morning to take her children to the kindergarten. It can explain the dry mouth and dry eyes. It can explain the cognitive impairment. The brain is full with receptor of the autonomic nervous system, which is spread all of our body. So what happened is that we have published in, again, unknown journal called Nature, that these autoantibodies were detected in patients with COVID syndrome. We have published that, for instance, in post-COVID syndrome, the level of these autoantibodies to the autonomic nervous system correlates with the severity of the symptoms. Moreover, we have found it in fibromyalgia. We have found it in chronic fatigue syndrome, as well as in sick building syndrome, but moreover also in the carrier of the silicone breast implants. So the question is, do you have a proof that these autoantibodies against the autonomic nervous system can induce all those panoply of complaints that are overlapping between all the clinical conditions that you mentioned: fibromyalgia, chronic fatigue syndrome, sick building syndrome, silicone breast implant, post-COVID syndrome, what we call the Asia syndrome? Yes, we do have the proof of concept. A researcher in London called Andreas Gebel actually purified these antibodies from the blood of subject from fibromyalgia. We did it from the silicone implant, and they injected them passively into the blood of collaborative British mice. We did it with collaborative Israeli mice. And then the mice reacted properly. They had hypersensitivity to pain, to heat, to cold. They had depression. They had cognitive impairment. They had memory loss. And he was able to show the binding of these antibodies to the receptors of the autonomic nervous system. So finally, as you can see, the whole circle is rounded now, and we understand a series of clinical conditions which by and large physicians didn't know how to handle them. They have sent the subject to many MRIs, CTs, blood work out, etc. Everything returned normal because they didn't send for the autoantibodies against the autonomic nervous system. So finally, when they found that everything is normal, the complainant subjective will say, everything is in your brain. And they prescribed them anxiolytic drugs, which didn't help, just made them more maybe depressed or with a lower activity. So now that we understand the mechanism, the Agios syndrome, the hyperstimulation of the immune system in genetically prone people, we can assume what would be a better therapy. So there are several suggestions, and I have to say that we are at the beginning of the end to understand and to develop a better therapies. So for years, and for years it means almost for a century, exercise was prescribed for all these conditions, and it helped in more than 40% of the subject. So you will come and say what the exercise is doing to the titers of the autoantibodies to the autonomic nervous system. It doesn't do anything. But the exercise stabilizes one of the arms of the autonomic nervous system, and this is the parasympathetic arm. This is the reason why when you are an athlete, you have a low heart rate. Some athletes have a heart rate of 40, 42 beats per second, per minute. So in any case, the exercise helped in many of the subjects, but once you stop the exercise, the symptoms may recur. So how to handle the autoantibodies? Here we have also some suggestions. First of all, there is a great studies done now, it's still experimental, to produce small molecules called aptamer, which will block the binding of these autoantibodies to their receptors. In animal models, it shows to be very effective. In human being, we are trying to see how we can get rid of these autoantibodies or neutralize them. And here we have several experiments which were done basically, human experiments, which were done basically in Germany. And this is cleaning the blood from the autoantibodies to the autonomic nervous system, a procedure which is not simple, it's not cheap, called plasmapheresis, in which you take the blood, you clean it, and you return it to the subject. There are already very good preliminary results to show that this therapy may help. Another way of therapy is transfusing a product called IVIG, intravenous gamma globulin. These are good missiles from 20,000 healthy subjects which did not develop any of those diseases and neither autoimmune disease. And it means to transfuse a good immune system to somebody who is sick. And these missiles, the good missiles from the 20,000 healthy normal subject to the sick person, they neutralize what we call the pathogenic autoantibodies that cause the binding to the autonomic nervous system receptor. The IVIG is well known to help in many autoimmune diseases, and we have used it for years in lupus, in multiple sclerosis, and in other autoimmune conditions. So in summary, we are autoimmunologists. It's not a specialty which is recognized by the medical association. It should be in the future. Mainly rheumatologists, but also neurologists, hematologists, and other disciplines are involved because the 100 autoimmune diseases are distributed in all the disciplines. We have a book which is called Diagnostic Criteria of Autoimmune Disease, and you can see the list of autoimmune diseases, how to diagnose them, etc. And we, the autoimmunologists, were lagging behind fields like cardiology, even hematology, but definitely oncology. And during the last 10, 15 years, many of the Nobel Prize winners received them because they brought us to better understand why our immune system is reacting outside and not redirected toward us. So our revelation following these decades of research explain why Mr. X or more prevalent Miss White develop autoimmune disease, why she, being a young woman at the childbearing ages, what do we need more that somebody who is genetically prone will develop the disease, the igniting mechanism, like, for instance, the silicone implants in these young women, like in some people, the vaccine with the adjuvant aluminum, while in other, it's a severe stress, while in many, many patients, these are the viruses which stimulate the immune system, like the notorious EB virus, but moreover, it's the COVID-19. So we believe that in the near future, there will be an increase in the incidence of different autoimmune diseases because of the COVID syndrome, and part of it is exemplified by what we call the post-COVID syndrome.